thought maybe just a good place to start this conversation is simply what is an ACL and what does it do? Because I know I've had an ACL injury, so I'm very familiar with it, but maybe a lot of people don't. Maybe they hear about these things on when they're watching a game on TV or something, and they're like, I don't even know what just happened to you. So what is it and what does it do?
No, it's a great question. And I think, like you said, we're very used to hearing it in popular culture. So the ACL is the anterior cruciate ligament. It's a ligament within the knee. And what it does is it resists the movement of the lower part of your leg going forward, right? So when you're running or cutting and you stop quickly, it's the ligament that's inside the knee that keeps the knee and the lower leg from moving forward. And so it's there to, what we say is we resist anterior tibial translation, if you want to go with the medical terms for it, but it's there to stabilize the knee, and that's its goal.
Okay. And so I know that's one of your areas of expertise. One of the areas you research a lot is how to prevent re-injuries. But I guess I'm just kind of curious when it comes to injuries in human beings. How do you go about researching that? Because I don't assume that you can, do a lot of live tests on like me to see how far I can push it. Or maybe you can. I don't really know. So how do you go about researching it?
Again, another great question. I think there are different ways that we think about sort of pushing human performance as well as kind of the injury prevention side. A lot of the work that we specifically do is focused on the biomechanics, on looking at the way somebody is moving. There's also the exercise physiology piece, which is another component, and certainly have amazing colleagues that do that work. But for us, it's about how does the human body respond to different things. And so often what we're doing is putting people through different sets of activities to see how they're going to respond to them. So if we're talking about prevention of maybe the first injury, we would do a specific set of tasks that we know tend to be related to the mechanism of injury. So they are similar movements to how somebody would get hurt. And what we want to do is understand, are there differences often between men and women is one question that we ask, but also as you go through growth and development, do we see a difference in the way you respond to those situations? And so for us, it really is like you would imagine. We try and create as best as we can a scenario that looks like something somebody would experience in sport. So lots of cutting, lots of jumping and landing, lots of changes of direction, especially when we're talking about the ACL. We can't always create the exact same environment. Obviously, we're in a lab setting usually, but with the technology advances we have now, we're getting closer and closer to being able to do this work in what we would consider game-like scenarios. We can't necessarily test in-game because it would require technology that most officials wouldn't let us use in a game setting, but we can certainly begin to look at some of these movements in live practice and things that are similar to that, or scenarios again that we set up hopefully as close to the end goal as we can get. But again, it depends on the question, right? And a task that we need to test.
Well, I'm curious. Just what are some general, like, common ways that folks injure their ACLs, and maybe what do those injuries look like? I mean, I know I said as we started this, I tore mine, so I don't.
Mhm.
That's my experience. I don't know if there is anything in between that. I don't know if like that's once it's torn, that's it. I don't know if there's anything worse than that. So what are some common ways that people injure their ACLs, and what do those injuries look like?
Right. So typically the injury is going to happen with a rapid change of direction. So that can mean different things. Cutting is one way, right? So you plant and then you change direction, either go left or go right off of that planted limb. The other way that it often happens is landing from a jump. So if you're playing basketball and you go up to grab a rebound and you come down and you land a little awkwardly, that's the other mechanism that we often see happen with our ACL injuries. I use basketball. It certainly happens in soccer and other sports, but it's really anything that is requiring a rapid change of direction is the most common mechanism for injury. Certainly, there are people who have what are called contact injuries. So what I described to you is a non-contact injury, and that is the majority of ACL injuries are non-contact. There are contact injuries which would be somebody hitting the knee. So if you're thinking about football and you get tackled and hit the knee itself, that can also cause an ACL tear, often also tears some of the other ligaments in the knee. Um, so ACL tears are interesting because they're not usually what we term as isolated. They can be, and it can just be the ACL. Often we will see an ACL tear and then sometimes a meniscal tear. So the meniscus sits and kind of covers the knee joint and is a shock absorber. And so what we would often see is also a meniscal tear. Sometimes that gets fixed. Sometimes it's not bad enough to fix and they just leave it. You certainly can go to the extreme where you have what we call a multiligamentous injury. And so more than one of the ligaments in the knee gets torn at the same time. We don't, in my research, aren't necessarily focused on the multi-ligament injury space because they tend to be more traumatic injuries. Skiing, you'll see that with, again, football, you will see that a little bit more. Sometimes I think we've seen patients who have done BMX and dirt bike racing and things like that, right? It tends to be a different type of injury than where we're really focused, which is on the non-contact ACL injuries, which are happening in our younger athletes who are high school age to early college. It's a completely different way of getting hurt, but there definitely is a spectrum.
Yeah, I think I can very vividly remember a couple of people that had multiple ligament injuries. Not that I know personally, but I just saw like during games, and it was like stop the game, clear. Like it's everything came to a grinding halt. So very clear, like those were not pleasant to watch. I guess I should say.
No,
Well,
they're not.
you mentioned young people, and focused mainly on that group. Is that the group that experiences the most ACL injury?
The majority of non-contact injuries happen between about the ages of 14 and it depends on the study you read, either 18 or 21. And so it really is a younger sort of adolescent population that we see.
Do we know why that is? Is it just they're more active, or
We have a definitive answer on that. We know, interestingly, that women are more likely to tear their ACL than men. It's about 4 to 8 times, depending on the study. So there's been a lot of theories over the years as to why. Some of that, the theories have been it's hormone related, it's sort of the way the body is morphologically shaped is another one. So hip width, knee angles, things like that, people have thought played a role. Some has been related to questions of strength. And honestly, I don't know that we've gotten to a point where we can give a definitive, like, this is why somebody gets injured the first time. There's a whole lot of research out there in really detailed down to like the slope of the tibia, which is one of the bones in the lower part of the leg, and the angle of that slope and how does that play a role. And so there's been a lot of theories. We haven't found sort of the golden ticket to like, this is how we prevent ACL injuries. And so I think that's still, for a lot of my colleagues, a major area of research. We've done a little bit of that, but again, my interest has really been in sort of the return to sport space where we're looking at how do we keep people from getting hurt when they go back again.
yeah? Well, I am curious. Are we seeing more ACL injuries now than maybe we have in the past, or do I just watch more TV? Are they just covered more?
And I think that the numbers, if we look at them from an epidemiology perspective, are about comparable to what they've always been. I think you're starting to potentially see it more in our high profile athletes than maybe we have in the past, but there's about the same numbers, and which is not what we want. Obviously, we want to see the numbers decreasing, not going up or not even staying consistent. I'm not sure that there are really more of them. I think we just are starting to be more aware of them. We're talking about them more. And again, you're seeing them in high profile athletes, and then they're starting to talk a little bit more about, well, how long are they going to be out as a result? It's starting to become sort of more of the conversation than maybe it had been in the past. And again, most of your professional athletes are slightly outside of the range where we would consider them at the highest risk. Like they're not typically your 14 to 21-year-olds. So that's part of it, right? It's a little bit of a different age group that we're starting to see. And so some questions about why, right? That certainly can be an area for people to begin to ask more questions.
Yeah, I was curious because I know athletes are. at least from what I understand, bigger and faster and stronger all the time. And I'm curious to how that impacts these type of injuries.
From the research side, from what we know from the literature, I don't know that there's anything definitive on that space, right? In terms of bigger, stronger, faster, sports performance based indicators of increased risk. Certainly, we know that there's increased risks, and we've talked a little bit about this before for the questions of early sports specialization and that placing people at greater risks. There may be some aspects of movement asymmetry, so one side moving a little bit different than the other, that are starting earlier because they are specializing earlier and they're not having as many different types of experiences as they once did. So again, I think there's a lot of questions that remain unanswered in terms of why are we seeing this maybe more or more elite athletes at kind of a little bit later age. There's also, it goes back to the second injury piece. In a lot of those cases, we don't know whether this is their first or their second, right? So we just are told they had an ACL injury. So it could easily have been a second injury or an injury to the other limb, and they had fire on the other side when they were in college or when they were in high school. So there's a lot that kind of plays into the question of whether bigger, stronger, faster in and of itself is doing this, or is it something different about the way we're training our younger athletes as they progress into those more elite spaces.
Yeah, maybe it's more of a sports culture type issue than it is just a
Could be.
physical issue.
Yeah. And there's
Okay.
certainly equipment questions that people bring up in terms of footwear. There's been lots of debate, especially in soccer, on footwear and how that potentially plays a role in injury risk. There's some great work that's come out of different places. The most recent one was out of the University of Oregon, where they were looking at female specific soccer cleats with the goal of trying to reduce injury risk in female sports. So there's an interplay, right, between the equipment that we have and that we use and the way that we move. And so those certainly can play a part in us thinking about injury risk and how do we prevent that and how do we reduce the risk as these athletes do the amazing things that they go out on the field to do.
Yeah, that makes a lot of sense to me, just completely anecdotally, because when I hurt my knee and then I went back and tried to play basketball is how I hurt my knee. And that's how I was like, well, I immediately need to start doing this thing that hurt me again. But I remember I started paying a lot of attention to how heavy the shoes were that I was wearing. I don't know if that had anything to do with it at all, but it felt better to me. So I know that I just started paying a lot more attention to that. I know that's your real area of expertise is that prevention, recovery and prevention of the second injury or another injury, I guess I should say. How often does somebody end up having another injury after an ACL?
I wish again there was a definitive answer on that. The literature is kind of a range. Somewhere around 30% is kind of the average. Caveat for that though is that is 30% of those who return to sport. And so we know that there's a large number of people that after the injury don't go back to sport or don't go back to sport at the same level that they were playing prior to the first injury. So we quote 30% as the number because that is what the literature has shown us. The numbers are probably slightly higher if you account for the fact that not everybody's going back, right? So if you assume that a certain percentage aren't going back into sport, we don't know whether they would have re-injured or not because they're not being put into the situation. It's a decent number of people. And I guess I should be clear that when we say a second injury, we're talking about either a tear of the graft, the one that was already fixed surgically, or the other. And so we talk about both as a second injury because that number is about 50-50 as to whether you're going to tear the graft or the other side, the other knee.
Is that just from like overcompensating?
That's my theory on it. I think there are different opinions on that. A lot of what we have focused on over the years is understanding side to side symmetry. So how is the reconstructed limb behaving as compared to the other side? Not to say that the other side is perfect, because obviously there was some movement deficit that existed that caused the first injury. But what the literature has shown us, at least in small scale studies, is that an asymmetry between the two limbs is a large predictor of somebody having a second injury. And so what we see often is that, and thinking about the amount of force that goes through the leg is the easiest way to think about this. There's certainly joint mechanics differences, but if you think just about the amount of weight or load that goes through each limb, what we see very consistently is that following surgery, even out to 2+ years following, they don't load the one that's been injured, and they tend to put more of the weight and the force through the non-injured limb if it's a bilateral task. So if you're landing on both feet, we tend to see a much higher force placed on the limb that did not get injured than the one that's been reconstructed. So that's a lot of why we think that the previously non-injured limb is the one that's getting hurt, is because they're overloading that side and it's taking on more than it's supposed to. On the other hand, there's the other side that's been reconstructed, and because they haven't been loading it, often we believe that injury, that second injury, happens because they're then put in a position where that knee has to do something that it hasn't been trained to do because they've been utilizing the other limb, right? And so our goals are often about, how close can we get them to each other, but not simply by making one better, but by making them both better and then getting the one that's been reconstructed up to that sort of higher level where we know that they're doing what they need to do to be safe going back in. And so I use load as the example. The way the joint is moving 100% plays a role in all of this. But the load piece is easier to explain and understand because you can see it just, and watching somebody stand there, they'll even stand differently and overload one side versus the other.
Yeah, I just had a conversation yesterday with my chiropractor about symmetry in my hips because things were not going well, and he was going to try to fix them. Um, but apparently I had a leg that was like longer than the other one, or maybe I still do. I don't know. He did a lot of pulling and stuff, and then he was like, "I think it's better now." And so
Yes,
I was
leg
like,
length inequalities play a role in a lot of this, and sometimes they're true leg length inequalities, which means that he could pull as long as he wanted and it would never be the same. And then some of them are what we call functional leg length inequalities, which means that something's going on in your pelvis and in your legs that is making it look like one is longer or shorter than the other. So he was probably doing some adjustments to try and make them seem similar or be similar again.
that was the goal, and to make it so that when I sleep, it doesn't hurt because I've reached the age where that's a thing. And I think that this all started because I slept wrong.
Yeah, getting older is one of those. It's not great for things like that.
When we talk about recovery and trying to prevent a re-injury, what are some keys to recovering well? I mean, how long should we expect it to take, and what should we be doing?
People don't love my answer on this one because everybody wants to get back as quickly as they can. I get that. Literature is very clear, and all of our studies are very clear that the earliest really is 9 months. We will push you farther than that if we need to, right? So it's about how well you're moving and how comfortable you are with it, right? We haven't talked much about it, but some of our work has started to focus on psychological components to recovering. So thinking about fear and apprehension, specifically fear related to a second injury, right? So are you nervous? Are you scared about going back in? What does that look like? How is that then impacting the way that you're moving? Because maybe you don't think the knee is as stable as it should be. So there could be a lot of reasons for the fear and apprehension. But a lot of what we're starting to, not just us, but the field is starting to think about is what is the interconnectedness between the movement mechanics that we've all been so focused on and some of these psychological metrics, again, of fear and apprehension. We, again, use a very big word called kinesiophobia for fear of movement. And that's been a growing area within the field for probably the last 5 to 6 years. It's just trying to blend these two worlds together. So when I say, there's no definitive timeline because each patient is a little bit different. Depends on your surgeon ultimately and the PT that you're seeing when they will release. But typically we're pushing 9 months or more, which is different than when I first started my career where, at 6 months we were releasing almost everyone. I think the work that we all have done over the years has sort of shown that they're not really ready at 6 months. I'm not sure that everybody's ready at 9 months. And again, we could get into the political pieces of like, how many PT visits do you have and how long
Yeah.
do you have to recover and what does that mean? And that, by political, I just mean in terms of like insurance coverage for you going into rehab and doing that work. So, it's tough because it is a long process. And again, these are younger athletes who are excited to get back into sport. So we're starting to see a decent number of them returning before the surgeon has actually cleared them to go back. And so that's another component is how do we get and continue to explain to people the importance of being really ready to go back and what the long-term implications are. So the other piece that I don't like to bring up to young athletes because they don't usually think this far down the line. And I hate to say it to you, I know you've had an ACL tear, but we know that in about, again, 10 to 15 years following your ACL reconstruction, you'll start to have early signs of osteoarthritis. And so, what if you look down the line, what that often means is you'll be having, or at least starting to have the conversation about a joint replacement in your mid 40s to early 50s, which is a lot earlier than we typically want to replace a joint because we know, again, it has a lifespan in terms of the joint replacement itself. So that's why, for me, the goal is I mean, obviously, we'd like to prevent the first one. If you've had the first one, if we can prevent the second one, then, you're not on that same trajectory for needing potentially both your knees replaced by the time you're 50 years old.
Yeah. It sounds like that one, my chiropractor visit was very well timed to this interview, but also it sounds like that maybe part of what you're trying to do is help people better understand how to have patience, especially at a young age.
Yes, and to be comfortable having the conversation about some of the fear components to this. Again, remembering that these are 14 to 18-year-olds, often they aren't willing to admit necessarily verbally that they feel like everything isn't great, right? Because they want to go back to sport. Again, we all understand this. The majority of us that are in this space either, are still athletes or, air quoted athletes or were. And so understand the desire to be on the field, understand the desire to be active and be out there with your team. The counter to that is, and that's the hard part to explain, is if you push this too fast, you may be back for a few weeks or a few months, and then you'll be back out again for another, 9 plus if you tear again. The other thing that we know is that you are at risk for other musculoskeletal injuries after you've had your ACL tear. So while we're focused on the second ACL injury, there's also literature out there that speaks to, muscle strains and ankle sprains and other lower extremity injuries that happen as people are going back into sport. And so lots of questions on how do we need to modify that process instead of just kind of tossing an athlete back in with their team? Like, what does the ramp up look like in terms of how they're going back into sport to prevent some of the other kind of overuse musculoskeletal injuries? So it's a good thing for us in the research space. There's still questions to be asked and answered, but definitely, I think the conversations again with the athletes, but then also with their parents about like what's the realistic timeline that we're talking about in getting them back, and let's think beyond this year to what are the long term implications of potentially going back to it.
Yeah, yeah. Well, what general advice, just whether it comes to preventing an initial injury or preventing a re-injury, but what's just some good general advice for maybe an athlete of all ages? I'm asking this specifically for my own self-interest. Like,
Okay.
what can you advise me to do to help better take care of myself?
I have my favorite topics of, don't specialize in sports too young. So that'll always be a thing that I say, especially if we're talking about younger athletes. Make sure that people are moving and moving well. Again, we don't spend a lot of time thinking about that with youth sports in general. Yes, it's important to be active and to be moving. We want to have that 100%. But we also want to be teaching proper form. And so thinking a little bit more about when you're running drills and doing things like that. Am I doing them correctly? Or am I just kind of doing them because the coach told me I needed to, go put, do X number of taps on the ball or shoot X number of free throws? Or are you really thinking about the way that you're doing them? I think another piece, which is not so much for the athlete, but more for the coaches, is watching the way your athletes are moving and understand that a lot of this isn't something that is natural. Like it's not like walking where we kind of all grew up and we learned to walk and we don't think about it. A lot of the movements that we're talking about are things that need to be trained and need to be well understood. So I use gymnasts as a great example, right? And most of us could not stick a landing like a gymnast could. That took training, right? They do it in a very specific way, and you don't see them tearing an ACL. They do a lot of other things and they get hurt in a lot of other ways, but very few of them are ACL tears, right? So are there ways for us to think about how we're training landing or how we're training cutting, and to do that within the confines of the sport that they're in? So there are some great injury prevention programs that are out there, and if done consistently, have shown benefit. The FIFA 11 Plus is the one that is probably used the most. So I always suggest when parents are like, well, what can we do as a parent group? You can look at something like that, which is publicly available, and say, you know, are there aspects of this that we can begin to implement within our sports program? I always say reach out to your local friendly biomechanist and or PT athletic trainer. They'll also be able to give you some great ideas on that. But in general, think about, and it's hard, right? When you start to think about, you know, kind of what we term as weekend warriors, people that just go out and, you know, they don't do anything all week and then they go out and play pickup basketball. That's a different model. Because what I would tell you is for that group, you probably need to be doing something throughout the week, right? There's a physical activity component that needs to be there so that, you know, you have the muscle strength and the coordination to be able to do the things you're getting ready to do on the weekends. And we already mentioned getting older is no fun. So just recognize as you age, some of that has to change, right? You aren't going to be able to recover as quickly as you age versus when you were, you know, 14 or 15 or 16. I think anybody who's in that process knows that well, right? We all know that, you know, the soreness lasts just a little bit longer the older that you get.
That's the truest thing that has ever been said on this podcast by far.
Yes, getting old is not fun, but that's, you know, we're all going to do it.
I guess I'm curious. You study these injuries. Do you also watch sports? Do you like sports?
Yes, I mean, I was a collegiate athlete, so very much of sports has been a part of my life, my entire life. I was not a basketball player. I played soccer in high school, but not through college. So the injuries that I study are not the injuries that I had, which everybody finds fascinating,
Well,
but it's just not what I did.
I'm just curious with somebody that when you study this, have you gotten to the point where you can see like when there's a football game on and somebody goes down, you're like, I know exactly what this is, like immediately?
Often,
Yeah.
yes. And I have the pleasure of being married to a physical therapist. So between the two of us, usually, and he's also an athletic trainer. So we often are like, ooh, yeah, that was for, you know, I've had a number of parents who are like, I really didn't think they got hurt. And then they'll show me the video and I'm like, yeah, right there, that step, right? That just comes with time and practice. The students in the lab love our fun game we've now started to play. Like I can identify people based on the way they walk. So as they're walking down the hallway, even if I don't see them, I can usually tell who it is. Your cadence and the way you walk is very individualized. So looking at and listening to movement becomes part of what, again, they're still learning it, but what we've all done for a very, very long time. So I think that it's the plus and the minus of watching sports for me is like when I start to watch somebody who's not moving well and you're like, okay, they're probably going to end up hurt, but you have no way of intervening in that, right? Like it's an external thing. So sometimes we do our best to kind of shut that part off and just kind of watch the sport for what it is.